So, good evening, everyone. Good morning, good night, good afternoon, or what time are you watching this video? So, at this juncture, we will now tackle about the preventive technology care for addiction and the like. So there are two ways on how to view the topic. At first is the using community health psychology and addressing technology addiction. And second is the using of technology and preventing addiction. So we will highlight the term addiction. First, we will define what addiction is. So addiction is not very new to us, or it's not new to us. It is introduced to us during our elementary days, high school, and even during our early years in college. So for formality, addiction is a multifaceted condition marked by an uncontrollable urge to seek out rewarding experiences, even when they lead to negative outcomes. It changes how the brain operates or the functioning of the brain, and it influences our behavior, resulting in continual craving for substances or activities that offer enjoyment or escape. Addiction can take many forms, mainly divided into substance related addictions and behavioral addictions. So, in our early years in college, taking up psychology, we we consider addiction as one factor, for example, the substance abuse or substance use addiction in the prevalence or the occurrence of mental illness. There are two types of addiction, which is the substance addiction and the behavioral addiction. So for substance addiction, it involves the dependence on substances such as drugs or alcohol. Hence, the alcohol addiction, which is the compulsive drinking that leads to physical and psychological dependence, and drug addictions, mainly dependence on illegal drugs or prescription medications. Another substance addictions are the tobacco addiction, on the smoking, caffeine addiction from our coffees, and others. The second type of addiction is the behavioral addiction, which encompasses the compulsive behavior that stimulates the brain's reward system and leads to significant impairment or distress. On the behavioral addiction, it leans more on the psychological effects of the activities, which is the pleasure on the or the stimulation of the brain's reward system. The best example for this is the gambling addiction and the internet addiction. For the internet addiction, it is more broader since it encompasses the addiction towards social media platforms such as Facebook, Facebook, Instagram, Twitter, what else? YouTube, TikTok, and other websites which can influence or can be a factor on the prevalence of pornography addiction, hence the sex addiction. Sex addiction is the uncontrollable sexual behavior that disrupts the personal relationship. Not only for personal relationships, but also disrupt the everyday or daily lives of the individual. Another is the shopping addiction, which is irresistible urge to shop that leads to financial issues and emotional distress. It also is related to internet since people nowadays are living on the virtual or the online world, and shopping addiction takes place also in online. For example, the Orange app, TikTok shop, Lazada, and any other online platforms are considered to be the medias or um, uh, the tools for the people to shop and others. For the others, here is for the topic for today, which is the technology addiction. So the topic one is using community health psychology and addressing technology addiction. We will define what is the technology addiction. It involves the excessive use of technology, which later leads to problems and distress. So when a person is addicted to technology, these activities are done to avoid or alleviate feelings of anxiety or irritability rather than the technology being for fun or recreation. An excessive and compulsive use of internet or online activities can lead to negative consequences in various aspects of an individual's life. So, technology addiction can potentially involve various forms of online activities, like, for example, the social media platforms, the gaming, for example, yung Valorant natin, the LOL, and gambling, for example, yung scatter, online sabong, and the like. Other problematic use of online pornography and others. This is from the American Psychiatric Association. Next is the application of community-based approach in addressing or trying to address technology addiction. First is the community engagement. It calls a community engagement calls for the collectivism. So it brings together the skills, the knowledge, and the experiences of diverse groups in creating or implementing solutions that can work for all the members of the community. Um, we need to highlight the community engagement since the participation of the community will make the projects or interventions in the future or preventive measures more successful. Next is the empowerment. We need to equip all individuals with the knowledge, skills, and resources to make informed choices about technology. We need to educate the people on how to use technology responsibly, and we need to educate them as well on the consequences or the negative effects of excessive use of technology or gadgets. Third is the social support, creating supportive environment where people can connect, share experience, and build resilience. Last is the environmental change. This is the modifying the physical and social environment to reduce exposure to technology and promoting healthy behaviors. In our report, we are given the preventive measures. However, we have given some interventions that can help in alleviating or addressing technology addiction. First is the public awareness campaigns. Since people are uh, prone in using technology, so why not use technology as well in creating or using it to raise awareness on technology addiction and its consequences. Next is the educational workshops. We can offer workshops and seminars to teach individuals about technology addiction, its causes, and coping strategies, or on how to use technology responsibly or how to manage the use of technology. Next is the community events. We can organize events and activities that promotes healthy technology use and encourage social interaction. We can also coordinate with the LGUs or NGOs in creating events that involve in physical activities. An example for this is for the Barangay Pugis and also other barangays here in La Trinidad. They are catering paliga or sports-based activities to encourage individuals to be active or physically active. Ganon. And also, in Barangay Pugis, they are having this program, currently having this program, the Weightless program, in trying to promote healthy lifestyles and to reduce the exposure of the individuals to technology. And other barangays are accommodating the daily Zumbas, exercises, and skills training. These interventions or these programs are made in order to lessen the time of people in using gadgets or staying at home, scrolling their phones, and alike. Another intervention that we can implement is the collaboration with the local organizations and stockholders. For schools, they can teach students about technology addiction and promote healthy use of technology. So, for example, yung current na ginagawa natin, through education, through schools, we can advocate, promote healthy use of technology, and try to educate people or students about technology addiction and how to prevent it. Next is for the libraries, they can offer resources that support digital well-being and literacy. For healthcare providers, they can open hotlines for queries, provide appropriate treatment and referrals for those who are in need of the interventions or the more in-depth intervention or treatment. For technology companies or yung mga companies na gumagawa ng ating mga gadgets, they can develop features and tools that promote responsible technology use. So there's a research that we have cited and they provided a diagram, the comprehensive intervention strategy and the global information system on digital media. I would like to highlight more on the prevention and treatment services because dito na more on dito na nabigay yung mga pwedeng gawin as prevention and treatment for technology addiction and also for the policy measures. So in the diagram, you can see the relationship between the environment, the host, and the agent. So under the host, we have the healthy use, harmful use, and addiction. And for prevention and treatment services, depending on the state of the host, you can see what kung anong pwedeng gawin. So, pag healthy use naman yung technology natin, pwedeng medyo awareness lang siguro ang kailangan or we can teach them preventive education and also screening. And for pag napapansin na natin na harmful use na yung paggamit ng technology, we can use the screening or brief intervention. And we can also include primary counseling para bumalik siya as healthy use. And for the addiction part, ito na medyo intensive service na yung kailangan in order to address the addiction. We can refer them for psychiatric services and rehabilitation or aftercare services. For the policy measures, we can say that yung environment, for example, the parents, the peers, the friends, the schools as well, yung mga taong nakakapaligid sa host natin, they can set a guideline or a ground rules para mapa-remind natin sa ating host na kailangan you have to limit their usage of technology. For example, yung shutdown or cooling off of gadgets. For example, may 2 hours ka na shutdown ng phone mo para hindi ka masyadong exposed sa gadget or sa technology. And the next topic is the using of technology and preventing addiction, which will be discussed by my groupmate.